Hematology, Chief of Hematology at Montefiore Medical Center. On June 19th, she's going to have something that's going to be spectacular. She's going to create the awareness. Her team is going to host the first annual Sickle Cell Awareness Day. Here to tell us more is Dr. Henny Billett. We welcome you to the show.
Good morning.
We're sitting at your most favorite place. Well, tell us about the sickle cell disease and how it affects the body.
Well, sickle cell disease is a miscoding of one of the genes that makes sickle cell. And because of that miscoding, it can't hold on to the oxygen as well. And when it doesn't hold on to the oxygen that well, it forms a rigid structure. And that rigid structure in the cell causes the cell to break up and to stuff itself into blood vessels. And when that happens, the oxygen doesn't get to the rest of the body. And the cells lyse and you get an anemia.
And what do you feel as a sickle cell patient?
So imagine an area of the body that doesn't get the oxygen it needs. It's not really a heart attack, but that area is waiting for the oxygen. It's not getting it. It feels pain.
Pain.
And then if there's really not oxygen, that area of the tissue can die.
Wow. And then what happens? That's really going off the deep end. Usually people get medical attention before that happens.
Oh no, it's just that area of the tissue. That's
Yes.
I mean, although certainly death can occur in sickle, most patients do fairly well with their sickle cell disease, but they get these things called painful crisis where when they're not getting the oxygen, they get these areas of really bad pain and they have to be treated with analgesia and fluids until that passes and the oxygen comes to where it needs to go.
And that's an episode that happens every so often. Is it chronic or does it stay with you?
Yeah, it's very varied. There are some patients who very rarely get a crisis. And there are other patients who can get crises 10 to 20 times a year. The crisis can last from 2 to 7 days.
Who is most affected by sickle cell disease?
Well, the gene occurred because when it's there only in one copy, it's protective against malaria. So that whole malarial area, Africa, India, the Arab, Middle East, Greece, Italy, all that area can have sickle cell, but primarily it's the black Africa that gets sickle cell anemia.
Yeah, so you said something protective against malaria?
In one gene copy, it is protective against malaria, and that's why it flourished in Africa. But in 2 gene copies, not trait, but disease, then you have sickle cell disease, and then you have these areas of pain and ischemia.
Are you saying this has formed to protect the person or the body against malaria?
Yes, so again, in that one gene copy, the malaria parasite comes in, it says, I don't really like this cell. This cell is, yeah, and it doesn't flourish in the body.
What is its impact in the Bronx?
Well, we have,
and
for
throughout
example,
the 5 boroughs.
For example, at Montefiore, we have over 1,000 patients with sickle cell anemia. 1 out of every 12 people have the trait, but again, so it's there are about, as I said, 70 to 100,000 across the U.S. and about 1,000 in the Bronx alone.
What's the difference between having the trait and having the actual disease?
Oh, an enormous difference. The trait really functions very normally. But when you have 2 copies, when you get it from both your father and your mother, then you have sickle cell anemia. And that's when you have that rigid cell that we were talking about that can just bust up and what we call hemolyze, and therefore doesn't last as long and gives you that severe anemia as well as
So the mother and father doesn't have to have, or necessarily have to have, a sickle cell disease, but they can both have the trait, and then you get it.
Right.
You get the traits from both.
You get the trait from both. You can also get different types of hemoglobin that can form to cause sickle cell disease.
And those are the only symptoms of sickle cell?
No, I mean, you can have this sickle cell occlusion of the blood vessels. This can occur in the brain and give you a stroke, and occur in the lung and give you acute chest syndrome. It can occur in the liver, it can occur in the kidneys and give you renal failure. It can occur in the bones.
Wow.
No, it can,
But people are living with it.
Yes.
People
so,
living with it. There's a lot of study. There's a lot of things. Any new studies that we're working on right now?
So, again, one of the fascinating things about sickle is the variability. Some patients do really well and some patients don't. So one of the things that we look for is, how do we know who's going to do well and who's not going to? And the patients that don't, what can we do? So we're looking at factors, for example, can we do something about the blood vessel that it's getting stuck in?
Yes.
So there are studies looking at trying to get those cells not to stick to those blood vessels.
So it gets stuck in the same blood vessel all the time?
No, different blood vessels.
Okay.
But if we can have a medicine that will not allow the cells to get stuck in the blood vessels, if we can do something to the blood cell itself that will not cause it, not allow it to sickle.
So there's no real cure yet, right? Or is it,
No.
are we working on one?
Well, bone marrow transplant is used in children in the quite severe. But because bone marrow transplant itself has significant morbidity,
Yeah.
it's really used for only a small subset. There is a drug called hydroxyurea, which we use for patients with sickle cell disease, which has been shown to significantly decrease mortality.
Yeah. Any side effects or anything from that?
None that are really not handleable. It does certain things that we want it to do.
It does
like
more good than
does much
bad.
more good than
Yeah.
bad.
So we're doing some wonderful things at Montefiore.
So Montefiore is, and has always been, a leader in sickle cell disease. We've been doing sickle cell for 30 years.
Yeah.
We were the first hereditary clinic in the country. So we have sickle cell clinics. We have people who do lots of basic and clinical research on sickle.
So the program is extensive. You've been doing it for over 30 years.
Yes, we were one of the NIH-funded comprehensive sickle cell centers, and now we are really reaching out to try to recapture this population.
Yeah. And what kind of research is being done to find new treatments for sickle cell disease?
Well, so as I said, we're trying to look for drugs that will stop the sticking of the cells. We're trying to work on gene therapy itself. We're trying to make the blood that is often necessary to transfuse these patients who are anemic
Right.
safer and more helpful for them. We're trying to stop the things that will precipitate these what's called painful episodes, painful crises, by using antioxidant therapy.
Is there something called gene splicing that they're working on to try to...
Well, gene therapy. So
Gene therapy.
we are working not directly, but in collaboration with some
Yeah.
people who are using gene therapy. Right now, it's still in the mouse
I'm
stage.
learning. That's
Still
why I'm
in the
just
mouse
asking
stage.
questions.
It's not yet in the people stage.
Okay, so we have the first of its kind there, the first annual Sickle Cell Awareness Day on June 19th at Montefiore. What's planned? How's that going to look, and what can we learn?
Well, what we're hoping to do is actually teach patients and everybody else about sickle cell disease. So we'll have patients there who tell people what it's like to live with sickle cell disease. You'll have physicians like me, I'll be there, but there'll be others as well, who will try to explain to people what sickle cell disease is, what you can do for it. We're going to have Eddie Gomez, a boxer who has a friend with sickle cell disease and is quite involved. He's going to be there in an effort to spur interest in sickle cell
He's
disease.
going to spar interest.
Spur and spar, yeah.
Okay, so how's it going to look? Is it going to be the outside area? Like
Yeah, it's going to be in the East Garden, so we're going to hope it doesn't rain. It's going to be in the East Garden. We're going to have leaflets and flyers and some giveaways
And some food
pulse,
and
some food.
drink.
There'll be nurses doing pulse oximetry so you can see how well you're oxygenating
good.
yourself.
Yeah. I mean, does that have a lot to do with sickle cell?
Well, so as we said, one
If
of
it closes out if it affects the lung area.
the lung and just the little blood vessels. If you can't get the oxygen through because those cells are sickling and stopping the oxygen from getting
Yeah.
through, it's a
And that
problem.
monitor can tell if there's a blockage somewhere in the body.
Yes, we monitor. So it'll tell you what the whole body status is doing rather than just a particular area. Right.
I'm just playing devil's advocate. I'm asking the questions. Anything we missed? We have this wonderful Awareness Day coming up. Did we cover everything?
Well, I'm hoping that people will come to Montefiore and learn about sickle cell disease and, talk to the patients and talk to
Okay.
us.
All right, the first annual Sickle Cell Awareness Day, June 19th, Montefiore. And it's going to, what's the address there again?
East 210th, 111 East 210th Street.
And do you have a website where we can find out more?
There is a website for hematology that has the sickle cell program in it, yes.
And of course, hematologists, they deal with a lot of blood, so don't faint. But we won't be dealing with that day. We'll be checking. Thank you so much, Doctor.
You're very welcome.
All right. We got the doctor here, Dr. Henny Billett, Chief Hematology, Montefiore Medical Center. We thank you so much for joining us this morning.
My pleasure.
All right.
Thanks.
Wait a minute, Dr. Minute.
Oh.
Doctor.